Hi, my name is Dr. Jamali, and I wanted to discuss why we take wisdom teeth out. Based on the American Association of Oral and Maxillofacial Surgeons, we remove wisdom teeth when they cause cavities on the other teeth or they have disease themselves. Impacted wisdom teeth can cause periodontal issues, cavities, and severe infections where patients end up in hospital. The best age to remove wisdom teeth is somewhere between 14 to 23, 24 years of age, or when the roots of the wisdom teeth are not formed completely. This is a 14-year-old patient. You see that the wisdom tooth is leaning towards the tooth adjacent to it. If not treated, this tooth will have a cavity. On this patient, another patient, older patient, it was not done, and we see the cavity formed by this wisdom teeth. So in general, I do not like to wait and see what happens. We like to remove the wisdom teeth to prevent damage on the teeth or infections. Here, the wisdom tooth has caused periodontal disease on this tooth. The bone level is here on the adjacent teeth, and then it drops down about 50%. So when the patient is below 23, 24, this bone will recover once we remove the wisdom tooth. But it's been shown that after 24, 25 years of age, the bone does not recover, and the patient ends up with a periodontal disease. The wisdom teeth can cause also cystic lesions or tumors, moderate loss of bone on the adjacent tooth caused by wisdom tooth. Sometimes the wisdom teeth are near the nerve, and we remove them as such, but I'll discuss that in my video about these situations. This is a patient that received a restoration by a dentist. However, again, got cavity underneath the filling. It's just hard to clean these teeth, which are located all the way in the back. Patients cannot floss properly or brush. This wisdom tooth has caused cavity, this darkness on this tooth. So sometimes, very frequently actually, these patients end up with having a root canal on this tooth and a crown, which can become expensive. This tooth is also leaning towards the tooth adjacent to it, but I do not see any cavity. But I don't like to wait until the cavity forms and then take the tooth out. I remove this wisdom tooth so the patient can clean properly and not have any cavity on the tooth next to it. Fillings were done on these wisdom teeth. I think it's a waste of time and money to do the fillings on the wisdom teeth, but because the patient gets cavities again, same patient on the left side, they have cavities here and a massive cavity underneath the filling that they have had done. Sometimes when we remove the lower wisdom teeth out, and the upper teeth will shift down by gravity, chewing on the lower gums or the cheeks, and the patient feels discomfort. Very frequently I see this at least once a week in my practice. This usually happens on the younger patients, 23, 24 years of age. When the tooth starts to erupt, the lower tooth, it doesn't have room, and it's covered partially by the gum. When this happens, the bacteria leaks in underneath, and the colony grows, and this tissue gets inflamed. Once it gets inflamed, and if the patient has an upper tooth, the upper tooth chews and bites on the gum, and it becomes pretty painful. Occasionally, patients cannot open wide. And this could be either guarding or a true infection. You need to be seen by an oral and maxillofacial surgeon immediately when that happens. Not all the time we remove wisdom teeth. This patient, the upper teeth were retained because I just thought thinking about risk and benefit. If I remove these teeth, that would cause more harm to the patient and cause sinus damage. And I just didn't see any necessity to remove these teeth. However, the lower teeth, we removed the top part of them because they were causing problems for the tooth adjacent. So that's it. I hope this video was helpful to you.